Thank you once again for spending time with us to learn more about what's happening throughout Northwest Illinois and at FHN as it pertains to COVID-19. Once again, I'm pleased to be joined by our expert infection preventionist, Margie Kochsmeier, who's going to share a lot more about what's happening. She has a ton of information to share today. One of the things that we do as an organization is try and bring you the latest information as we learn about it. It's an ever-changing environment. But I also encourage you to go straight to the source material. If there's anything you ever hear that you're questioning, go and find the facts for yourself. We want to make sure that we provide you as accurate information as we possibly can. And thank you once again for spending some time to learn more about what's happening.
Vaccinations were developed to help us prevent getting diseases. The vaccine triggers an immune response in our body, so when our body sees the virus again, it can fight it off because it has antibodies for it. No vaccine is 100%, and even when we talk about vaccines like smallpox, which has been eradicated worldwide, we have 95% effectiveness with that. For influenza, if we have a well-matched vaccine with the strain, we still only see about 60% protection. When we started with COVID, we had about 90% protection with our vaccines, and since the variant strains have come out, we've dropped that somewhat down into the 80%. For people who have been vaccinated versus those who have no protection at all, you are 8 times less likely to get COVID. You're 25 times less likely to be hospitalized and 25 times less likely to die from COVID. And remember, we said no vaccine is 100% effective. As many of our vaccines provide us protection for many years, it is not always lifelong. For kids, they get vaccines when they're young, and then they have to get booster shots because they need a booster in addition to the vaccine to help protect them. To give an example, polio is 99% protective for about 18 years. And while we don't see polio in the United States, this is the reason why if you travel outside the country, you may be asked to get a vaccine again. Measles provides lifelong protection, but this is not a reason for children not to take the vaccine because they need the protection just in case they come into contact with somebody who has measles. Vaccine can reduce our chances of getting sick, so we may still get a disease while we have certain vaccines, but we're not going to get as sick. The variant strains of COVID have changed what we're seeing as far as protection for our vaccines. And the more this virus circulates and changes or mutates, it's going to make our vaccines less effective. A breakthrough case is when somebody gets an infection for a disease that they've been vaccinated for. In breakthrough cases, like COVID, we'll see someone come in that's been fully vaccinated, but they don't get as sick as somebody who has no protection at all. Breakthrough infections don't mean that the vaccine isn't working or that it's not effective. What it means is that it's not 100% protective. And the more this vaccine circulates, it's getting stronger, and it is going to make our vaccines less effective. While it's rare to see some of these breakthrough infections, the changes that we've seen with the Delta variants have increased the risk of breakthrough infections that we're seeing. Those who are vaccinated still have less chance of becoming critically ill if they do get sick. And again, as these strains are changing and it becomes stronger, the vaccine is becoming less effective. Well, taking a vaccine for a preventable illness is always what we want to do. But remember, the vaccine by itself may not be enough. So it's those protective precautions that we take, wearing a mask, being careful of crowded places that we go to, good ventilation in a room, like a school room, opening up the window, and by bringing in outside air, you can dilute the virus that's in the air. I don't see us needing a vaccine for every one of these variants, and they are changing so much. What I see is that we will probably move to something annually so that it will be updated every year, much like the flu. A lot of people worry about this, that maybe it moved too fast. Any vaccine that is either fully approved or emergency use authorized has to go through the same testing and show that it will prevent the disease that it's intended for. Had the paperwork for the vaccine, for the emergency use authorization went through all the steps that it needed to, a lot more people would have died before we got the vaccine out. This vaccine showed that it was safe and effective, that it was working, and what really needed to happen was to get this into people's arms so that they could be protected. The vaccine is safe and effective. All vaccines, again, have to go through very careful review, and these are by scientists and doctors and FDA. Centers for Disease Control and Prevention and FDA continue to review patients and data to make sure that it's remaining safe. And the FDA does not do the research on this. The FDA reviews the data and the clinical studies and then makes the determination on whether or not the vaccine should be approved. The boosters for Pfizer and Moderna are not new vaccinations. This is an additional dose. It's the same amount that was given in dose 1 and 2. And not everyone needs this at this time. There are people that have compromised immune systems, and much different than somebody who has that is very healthy. It's going to take them 3 doses to get the immunity that a healthy person would get after 2. So for now, there is no change in the vaccination, but in the future, if an annual vaccine is needed, we may see a different combination. Data is being studied, though, to see who fits into this category of needing a booster. As of now, again, the boosters are only for people with compromised immune systems or at risk if they get COVID. This would be someone like a transplant patient, a cancer patient. The FDA met on September 17th to discuss if anybody additionally needed to be into that category. And they said people who were over the age of 65 and those that were at risk. For the general public right now, there is no recommendation to get a booster. A vaccination for kids under 12 is in the works right now. It will be a lesser dose than what we're seeing for the adult dose. The clinical trials are underway, and we may be seeing something as early as this fall. It takes time to review the data from the clinical trials. We have to make sure that the dosage is right for the kids, that it's safe, it's effective. We didn't rush this process for adults, and we certainly don't want to rush it for our children's. As soon as it's adjusted, it will be available for kids, and it'll be available for them to take one. According to our state, 100% of what we're seeing right now is the Delta variant. We know that this strain is stronger, it's transmitted easily. 1 year ago, remember, everybody was wearing masks and keeping distance, and we've kind of come back together a little bit, which has increased our risk. Remember, not everybody is vaccinated, so we have the risk of transmitting this to people that are very vulnerable. What we've seen is that the Delta variant is affecting people that are unvaccinated more so than people that are vaccinated, and children are falling into this category. A parent being immunized is probably one of the best things that they can do to help protect their kids. But remember that vaccinated people If they're in contact with somebody who has COVID without symptoms, they still could transmit this to other people. Follow guidelines that are set for kids to keep them protected, and that may mean wearing a mask in crowded places. Keep hands sanitized, especially after being out in public. Healthy people are dying from COVID, and this is including children. Follow the precautions that your school have set for you. Schools are working with their local health departments to have these guidelines set that is going to keep your child as safe as possible. Flu shots are going to be especially important this year because we're going to have two viruses that are circulating, COVID and influenza.
Unfortunately, we've seen a significant trend going in the wrong direction with COVID-19 patients. For the past month, consistently, we've been seeing our COVID-19 patient census in the teens. It's fluctuated a little bit, but remains at a little bit of a higher volume than we were seeing in June or July. As a comparison, there were days that we were fortunate that we didn't have any COVID-19 patients in the hospital, and then we were averaging between 2 to 4. And now those numbers have certainly been much higher, and as of today, in the past week, we've experienced 6 COVID-19 related deaths and a number of people on a ventilator. So we are certainly seeing an increase in activity. We're doing all that we can, which includes very frequent cleaning like we started with the pandemic. We're making sure we're trying to have enough distance in between people, spacing out our timing for appointments, trying to make sure that all of our staff are being kept safe. We're doing weekly testing for any staff member that may be unvaccinated. Vast majority of our staff are vaccinated, and well over 90+% of our provider staff is vaccinated, as an example. But we also want to make sure that we're staying on top of these increased activity hotspot areas and applying a little bit additional scrutiny and extra effort to make sure that we're providing a safe, clean environment for all of you. I'm glad to say that we've been able to manage the increase in activity without disrupting our elective procedures. It is a conversation that we engage in on a regular basis on what is our ability to continue to provide these services in a quality that we can be proud of. And so far, we've been able to maintain that. However, if we do see much more of an increase, that's always a conversation that may come up, and we'll have to make those tough decisions. But now is a great time to get those procedures scheduled before the end of the year so that we can have the privilege of taking care of you and your family. I don't know. As you asked, what do I think? I wish I had a better answer, but we certainly know that there's good criteria out there already that this is going to last past March of 2022, and that's if we're able to avoid a significant surge or control a surge over the next few months. But it certainly can extend well into 2022 at a minimum. Once again, we don't know the answers for certain, and not many people who say they know the answers could say that with a good deal of confidence because it's just so new. What we do know is that there will always be people that are highly vulnerable to viruses, and it will remain very dangerous for them, which is what we need to keep in mind with continuing with our safe practices and helping to protect others. At the time of this video, we've just started the beginning of a fall season, and it's always a great time to get that last hurrah outdoors with hiking, camping, and some of those other activities, as well as enjoying a lot of what's going on throughout our community. Please continue to support your local community businesses, support each other. If you know of a healthcare worker, thank them for the work that they're doing. They're working incredibly hard to make sure that they're able to take care of all of you, and that takes a toll, and a kind word really does go a long way for all of them. Be patient and be kind with one another, as we will get through this, and we'll get through this together. But again, keeping in mind that tomorrow is going to be a different day, and we're all looking forward to a better day. Thank you once again for choosing FHN and allowing us to be able to serve you.